Hey guys, it's Dr. Keo, and I want to answer a question that I receive frequently, which is, why would a pregnant woman be adjusted by a chiropractor? Well, first and foremost, I recommend safe, effective, and gentle chiropractic care to all women, whether they're thinking about conceiving a baby, they already are pregnant, or maybe they're in the postpartum period of their journey. Because if a woman has an imbalance in her pelvis, it's going to create a condition called intrauterine constraint, which, when the woman does become pregnant, that can affect how the baby is able to position themselves properly inside the mother, as well as how well that baby can grow and develop. So this can affect the mom's ability to have the most natural and non-invasive birth. So there's a lot of benefits to being adjusted prior to conception, all throughout your pregnancy, as well as into that postpartum period of your life. So here's a list of symptoms that most women are coming in for when they already are pregnant. And the first one, the top of the list, is low back pain. Very, very common when women are pregnant. It's very common to have low back pain, as well as things like sciatica or hip pain. Also, headaches, nausea, round ligament pain is really, really common. Malpositioned babies. We see a lot of women coming in that are wanting to have the most natural, non-invasive birth, but their baby may be in an abnormal position, like posterior lie, the transverse position, the breech lie, so breech presentation. We also can really help with things like SPD, which is symphysis pubic dysfunction. So if you've ever had that, you know what that is, and it's a very painful condition that really only affects you when you're pregnant. And then there's other things that aren't as common, like vulvar varicosities. We see women for that. We really get great results with that. It's not as common, and it goes away right after you have your baby, but it can be really, really painful during pregnancy. So again, it's best to start chiropractic care before you even conceive your baby to greatly reduce the chances of developing any of these symptoms that we talked about right here. And then we have to talk about what techniques we use. So we are certified and trained in the Webster technique. The Webster technique is an assessment as well as an adjustment to help identify imbalances in the woman's pelvis and then help us know where to adjust her in a safe and gentle way to help get her pelvis in the best balance that we can possibly get it in. In doing that, that's going to create the room that the baby needs. So not only is mother benefiting from this, but also the baby is benefiting because now the baby has the room it needs to grow and develop and position themselves properly for when the birth process gets there. So it's also important to realize and to understand that getting adjusted after you deliver your baby is really, really important for mother to help her get out of pain quicker, help her in her recovery and her healing process, and to ensure that her body comes back into the best balance and the best alignment, because that's when the pregnancy hormones are still very high. So that's the best time to come in and be adjusted is within the first few months after that baby is born, because of hormones like relaxin and progesterone, of course. So if you're pregnant or you're thinking about becoming pregnant, or maybe you recently delivered a baby, it doesn't really matter where you're at on that journey. Maybe you want to get out of pain, or maybe you just want your body back after the baby is born, or maybe you're wanting to have the most natural and non-invasive birth you can possibly have. Please give us a call. We can help you. We can help you achieve your goals, or whatever those may be, throughout that journey from preconception to pregnancy to the postnatal period. Give us a call at 636-244-4994. We look forward to helping you. Have a great day.